Hi, welcome to San Juan, La Union, the surfing capital of the North. San Juan, La Union is around 270 kilometers north of Metro Manila. Previously, it would take you around 6 hours to get here. But now, after the completion of the NLEX, SETEX, and TPLEX system, which extends all the way up to Rosario, it is now an easy 3.5 to 4 hour drive to San Juan. San Juan is known for its surfing waves. This area behind me is known as the beginner waves. So if you're new into surfing, this is where you should be. And as you go northward towards the shore, the waves become bigger and fit for those who are expert surfers. So we'll get back to that later. Right now, let's get to our business. The Osce, the Objective Structured Clinical Examination. The Osce has received a lot of attention recently due to the shift of the Philippine Board of Emergency Medicine to the Osce format in conducting its diplomate oral examinations. So, what is Osce? Is it designed to fail the students or the examinees? Is it designed to make the exam more difficult? So what is Osce all about? Let's find out.
One of the most challenging tasks, and probably the most challenging task facing an educator, or in our case, a training institution, is to be able to properly assess if the trainee is qualified to be promoted to the next year level, to graduate from the training program, or in the case of the specialty board, if the graduate is qualified to practice the art of emergency medicine. So the assessment tool should be able to see if the trainee has indeed acquired the necessary knowledge, skills, and attitudes necessary to practice emergency medicine independently, anywhere in the country. So what is Osce? So Osce is the gold standard for performance assessment. It is an examination like no other. And by definition, the Osce is a performance-based examination in which examinees are observed and scored as they rotate around a series of stations according to a set plan. Each station focuses on an element of clinical competence, and the examinee's performance is assessed by an examiner. With the recent thrust of the PCEM, the Philippine College of Emergency Medicine, to go into the OBE, the outcome-based education, in our curriculum, it's now more important for us to be able to use the proper assessment tool in checking if the learner has indeed achieved the necessary learning outcome. So what we choose to assess is an indication of what we value in the training program. So at the end of a particular period, the questions that we ask the trainee will impact on what the trainee will be studying or focusing on in his or her training. So for example, if we focus on physical examination or history taking when we conduct our examinations, then the trainee will then put emphasis on history and PE during his training. But if at the end of the course, we don't ask questions regarding history and PE, then the trainee will feel that that is not important, and during his training or her training, they will no longer focus too much on the history and PE. So the assessment tool and the questions that we ask or what we test for will impact on the learner's behavior and study patterns. So now we have to look into the relationships between assessment and learning. So there are two levels. The assessment of learning, which means at the end of the course, we have an assessment tool wherein we test if indeed the learner or the trainee has acquired the necessary knowledge that we were trying to teach them in the curriculum, as compared to the assessment as learning. So now assessment becomes an integral part of the training program. So if you look at the way it's structured before, in the curriculum, we give out the necessary objectives, what we want them to learn, and then based on that, we come up with an exam. And many times, the exam this is not congruent with what we were trying to teach them in the curriculum. So now the approach should be from the end. So the approach should be design the assessment tool, design the questions that we're going to ask or what's important in our outcome, what outcome we want, and then design the curriculum based on the outcome. So that is how the outcome-based education works. And in tandem with that, OBE is partnered with the Osce. So what is the importance of assessment? As I just mentioned, it affects your curriculum planning. So what we want to assess in the end will impact on how we will design our curriculum, how we will design our instructional courses. Okay, so again, there's a shift in thinking from the old style of designing the curriculum first, then doing the test, compared to now we will do the assessment tool first and then base the curriculum on our assessment tool. And also another aspect where we can use a good assessment tool is in our trainee selection. So when the time comes when we have more trainees, more trainee applicants to our programs, we will be able to have this assessment tool to choose the more qualified trainees, more qualified candidates to join our training program. Okay, so what are the criteria for a good assessment tool? First is reliability. It should be a reliable assessment tool, meaning it should give you consistent results. So if you have an examinee who takes the test today, then takes the same test next week, you will always come up with similar results. So that is reliability. And for validity, the assessment tool should also be valid, meaning we should be asking the correct questions. We should be measuring what we need to measure. What usually happens in the old traditional examinations, the examiner will just ask a whole bunch of questions not related to the outcome. So again, going back to the OBE, the questions that we ask should be what we would want to measure based on our OBE curriculum. And assessment tool should be feasible, meaning it is a practical way of gauging the performance of our trainees. It's not expensive, it's cost effective, and can easily be performed in our institutions. So another criteria would be, it should be accepted by the trainee. So the trainee should realize and accept that this assessment tool is valid and is important, and the trainee will value what outcome he gets from the assessment tool. So if the trainee does not do well in the assessment, then it will impact on him or her to improve himself in his training. So otherwise, if the assessment tool is not valid, the trainee does not believe in the assessment tool or thinks that the exam is a joke, then it has no impact on his training because he would not care whether he does good or bad because he does not believe in that exam. So the exam or the assessment tool should be accepted by the trainees. So in the standard assessment before, the focus is on theory, so knowledge acquisition. So it's purely a recall type of test. But now in the new assessment tools that we're using, like the Osce, the focus is on to make the exam valid. So we want to measure the things that we should be measuring. So we want to assess the clinical skills and competencies rather than just checking for knowledge or theory. So this is now the new focus of an assessment tool, validity. So the Osce dominates the performance assessment tool. It is the best method to formally assess clinical skills. And as another added bonus to the Osce, the feedback mechanism. So it's very important to get the feedback of the examinees after taking the Osce. So we should be gathering our examinees after taking the Osce and do a good debriefing so that we'll be able to find out where we are strong, where we are weak, and especially where we are weak so we can strengthen that aspect of our training program. So what are the future goals of the Osce? As I mentioned earlier, we can use that to assess trainees when they end particular year levels. So for example, at the end of the first year, we can do an Osce to determine if the trainee is qualified to be promoted to the next year level. So we can do this for every year level. And before graduation, we can do an Osce to determine if the trainee is qualified to graduate from our training program. At the same time, from the feedback that we get in conducting these Osces, we will be able to evaluate our teaching methods. Okay, so again, where we are weak, our weaknesses, we will see our weaknesses and then make the necessary improvements in our training programs. And once we have more applicants into our training programs, we will be able to use also Osce to find out who among them are the better candidates for our training programs. So Osce, O is objective. So one of the biggest drawbacks of the old style of testing, the oral exam, is that it's very subjective. So we want to do away with that, and then the Osce being objective is the forte. So beforehand, we have a test blueprint. The examiners will have to come up with a test blueprint and determine how many stations they should have and what cases will be involved in each station. Okay, so the examinees will pass through the same stations. So all examinees will have the same cases. Unlike before, your case is raffled off to you. You choose a case, and if you're able to pick a case that you had just reviewed, you're lucky because you'll be able to perform well. And if you're not, you choose a case that you haven't read for a long time, then you might have difficulty passing that. Okay, so here in Osce, it's very objective. All examinees will pass through the same stations. The same questions will be asked in all stations, so all examinees will be asked the same questions, and there's a clear specification of what is being assessed. Okay, so it's not a free-for-all flowing type of exam. So beforehand, in the test blueprint, the questions are already determined, and the examiner is already there waiting for you to to give the correct answer, or they're waiting for you to give the correct keywords or phrases that they are looking for. So it's structured. So the standards are specified. So we already know beforehand what to expect from the examinee. So if we're doing the OSCE for a first year level trainee, then we only expect so much as compared to, let's say, the senior graduating resident undergoing OSCE, we expect more from them. And beforehand, in the test blueprint, it's already determined what the minimum passing level will be. So it is not something that the examiners will deliberate on after the exam to see if the examinee passed. So it is already very structured from the start. They already tick off the answers that the examiner gives, and right after your station, the examiner already knows whether you passed or failed that exam. So again, each examinee will receive the same number of minutes per station, and it's clear for a particular station what is being assessed. So it's not anything in the book type of question for a particular station. Unlike in the old style, the examiners can ask you any sort of question while you are defending your case. Okay, so in the traditional exam, the old oral exam that we used to do, it has a very low reliability. Okay, so it really depends on the case that you pick that's raffled off to you, and there's very little sampling. Imagine your future career is determined by one case. So if you're lucky, you get a good case. If you're not, then you get a difficult case, and you might have a bigger chance of not making it to a passing level. And there's no organized flow. So the questions being asked to the examinees will depend on how the examinee is answering the question. So it's free flowing, and there's a very high potential for examiner bias. So this is really what we want to avoid in the exam, to be very objective, and there should be minimal potential for examiner bias. So again, it's clinical, so it's performance based. So we need to determine, like especially in our training programs where we are also training them on particular skills, we not only test for knowledge, but we have to test for the application of the knowledge. So how to put their knowledge into practice. So when they're given particular cases, it's not enough for them to know the basics. They should be able to apply what they know in order to handle or to properly answer the questions. So there are 3 clinical levels in the training, or in what we want to assess. So the most basic level is the knows about. So the trainee, let's say in intubation, the trainee knows about intubation. The trainee knows the indications for intubation. Okay, so that's the basic. You know about the particular procedure. Then the next level is you know how to conduct the procedure. So let's say you know how to intubate the patient. You know where to insert the laryngoscope, how to position your hand, and all of that. But that doesn't really show us, as the examiners, if you really know how to intubate the patient. So the highest level should be to show how to do it. So this is where the OSCE will excel. You will need to show us how to do a particular procedure. So it's like a driving test. So you can get a 100 grade in your written driving test. You know all the rules, but in the end, you don't know how to move a car from point A to point B, or to maneuver that car. So that is where the difference lies in the OSCE. You should be able to show the examiners how to perform a particular procedure. Okay, so again, going back to our example is in intubation. So traditionally, we would be asking all sorts of non-relevant questions, like write short notes on the origin of intubation, or describe the materials from which an ET tube is made. These are some questions that are asked in oral exams because it is free-flowing and there's no structure. But in the end, all you really want to know is this, the ending, which is to be able to observe the individual or the the trainee, examinee, can perform intubation correctly. Okay, so observe an individual, intubate a patient. So that is the goal of Osce. So later on, we should be able to have these different stations for skill demonstration. Okay, so as we mentioned, the Osce emphasizes on checking for examinees' clinical skills. Okay, so how an examinee will fare when faced with a clinical situation. You will also see the attitudes of the examinee as they are confronted with a difficult case. So the way it is designed, it's not enough for you to know the basics or to know the theory, but you should be able to apply your knowledge to be able to handle or manage the case properly. So we minimize asking secondary questions and what we would call irrelevant questions to the case. So if you have all those other questions that you want to ask, those questions should be asked in the written exam. So that is why there's a written exam and the oral exam. So during the written exam, that's where you ask all of your other questions that you want to ask. But during the conduct of the OSCE, the question should be already concentrated on the particular case. So there should be no secondary or irrelevant questions asked for that case. Okay, so eventually, as we progress with the OSCE, since we're just starting, we haven't been able to do this yet. As we progress, we will be having procedure stations where we will have patients. So we can have simulated patients, meaning people who are not patients but have been oriented to give the proper answers when asked by the examinee. So this is already happening in some of the medical schools that do not have their school attached to a university hospital. So they bring in people to act as patients. And then when the students interview them, their answers are already programmed to lead to a particular diagnosis. And then later on, as we progress again, we will be able to have real patients where we can interview them properly. Okay, so the OSCE should be flexible. There should it should not be a rigid format. So it should be dependent on the particular specialty. So like for example, in emergency medicine, we can design it where we can have let's say resuscitation machines or like the ones we have in doing the ACLS testing. Okay, and it also the format is flexible to be able to accommodate the number of participants taking the exam. So that's flexible number of examinees, and the examiners will be patterned after the number of examinees, and we can design the number of stations that we can have for the exam. Okay, so just like in our rapid sequence intubation, RSI, where we have our 7 Ps, in OSCE we have our 8 Ps. So first P is performance assessment. So the thrust of OSCE is to move from theory to practice. So we test not only what the examinee knows, but how to apply the knowledge that they know in managing a clinical situation. So it's no longer just theory, no longer just recall, but now there's application. So P number 2 is process and product. Here we're assessing technical skills. So it's only in an OSCE type of exam are we able to assess a technical skill. Okay, so for example, we can check on how they take the history, how they do a PE, or how they perform a particular procedure. So it is now a skills assessment. Okay, the result of the OSCE gives us a picture of the examinee's status in the training. So we can find out the strengths and weaknesses of the trainee, and if they are grouped together from a particular training institution, we'll be able to find out where the strengths and weaknesses are of the particular institution. So it's a very important aspect to be able to determine or look into the profile of the trainee. And again, as we start implementing our OSCE in the different tier levels, we will be able to gauge the progress of our trainees. So how much better is the second year compared to the first year resident in terms of their performance in the OSCE. So there should be better performance expected from a senior resident compared to the first year resident. Okay, so it's very important to provide feedback to our trainers also. So after we have conducted the OSCE, it is important that the training institution gathers all of the examinees from its training program and to conduct a serious debriefing to find out really what happened, where we excel and where they had a difficulty. And then we can restructure or make changes to our training programs. Public assessment. So there's transparency to what is being assessed. So in the OSCE, it is not a secret hush-hush type of exam where you will surprise the examinee on what questions you will be asking and what you will be focusing on. So in fact, if you recall, in the previous OSCE, it was announced that, for example, we will be asking you questions on images from imaging images for X-ray, ultrasound, CT scan. So it's not a surprise for you if you're shown all of these pictures that you need to interpret, okay? So again, the OSCE is partnered with the outcome-based education. So as we shift to the OBE in our emergency medicine curriculum, it is just proper that we also shift to the OSCE in terms of our official assessment tool. So in OSCE, we can also make use of get the assistance of different specialties. So for example, if the station calls for a sedation case, we can ask the assistance of, let's say, anesthesiologist to help us with that particular station, and in fact also have an anesthesiologist as an examiner for that station. Or if we have a pediatric case, we can have a pedia consultant with us in the design of that station, and also have that pedia consultant act as an examiner for that particular station. So as we develop the OSCE in our training programs or in our college, we should have more stations in the OSCE proper. So ideally, we should be having like around 6 or 7 stations when we conduct the OSCE, so that we will have a higher yield. We'll have more cases and we'll have a better profile of our examinees. So the 7P is pressure for change. So a poor overall performance in the OSCE highlights the need for change. So there's nothing to be ashamed of if you determine that there should be something changed, because even the best can be made better. So we can make changes in our training programs or make changes in the way we assess our residents so that they will be better prepared to take on the OSCE. In fact, all of these preparations we do in our training programs is geared towards eventually the ultimate of having our graduates pass the specialty board exams. And of course, the 8P's preset standards. So the test blueprint is constructed prior to the exam. So the examiners get together and create the test blueprint. So they determine what is expected from the examinee. They determine the standards of performance and the minimum passing levels. So even before the exam takes place, the examiners already know what it takes for an examinee to pass that OSCE. So it is not something that will be dependent on how you answer the questions on the day of the exam. So it is already predetermined that this will be the passing level. Okay, so in summary, the OSCE is a very reliable assessment tool. It provides consistent results. It is a very valid assessment tool, and if designed properly, it should measure what should be measured. It is a feasible tool because it can be used in a range of situations. It can be adapted to the budgetary requirements of the institution or the hardware availability of the institution. So the OSCE is a flexible assessment tool. It can be adapted to the local situation. So right now we have this pandemic. So based on the IATF guidelines, we can pattern our OSCE examinations. And it is perceived as fair by examinees and examiners. And with that, it is acceptable as a good assessment tool. So the trainee will believe in the outcome of the OSCE and will be able to improve himself or herself based on his or her performance in the OSCE. So the feedback mechanism is a very important and powerful feature of the OSCE. So we should always conduct a debriefing and get the feedback from our examinees on how they fared, and it will help us in the improvement of our training program. So that's it for our primer on the OSCE. So if you have any questions, you can contact me after this talk. And thank you very much for listening, and I will see you in San Juan, La Union.